Good afternoon. I'm Sophie Rovner. Welcome to this news briefing of the 253rd National Meeting and Exposition of the American Chemical Society in San Francisco. We're joined today by Dr. Mangilal Agarwal and Dr. Amanda Siegel from Indiana University, Purdue University, Indianapolis. They will be talking to us about their work on how sniffing urine to detect prostate cancer could prevent unnecessary biopsies. Dr. Agarwal?
Thank you, Sophie, and thank you, ACS, for providing this opportunity to address this important problem. So you can see that we have a very multidisciplinary team working on this project. And I'll introduce the project, and then Amanda will talk about more specific results that we obtained from this project. So about 1.3 million men in US each year undergo biopsies, and about 1 million of them doesn't need require further treatment, but require more biopsies. So this shows that we need a better diagnostic tool, especially non-invasive, to screen prostate cancer. On the other hand, we can see that recent studies shows that dogs can sniff from urine headspace and detect prostate cancer at a selectivity and specificity of 98%. So what we are doing is we are exploring this big question: what is that smell that dogs are sniffing? And to do that, we use analytical tools, and we collect urine samples from our VA collaborator and use the analytical tools to distinguish what is that smell in the urine headspace. And then once we identify that smell, we are also planning to validate that smell with trained canines so that the biomarkers that we identify are in what we call can be readily or speed acceptance of the community. Then the plan is not to stop there, but also to develop non-invasive, like a urine stick that can test prostate cancer in real time in a doctor's office. So that's the overall project that our group is working on. And to talk about some specific results, I'll pass on to my postdoc, Amanda Siegel.
Thanks, Mangi. So for 85 urine samples that we collected from patients at the VA hospital coming in for a biopsy because they either had high PSA levels or nodule found by digital rectal exam or family history, we looked at the results of the pathologies of the biopsies, and so 33 of them didn't have cancer, 38 of them didn't have cancer, 33 had cancer that required further treatment, so Gleason 7+, and 14 of them, the biopsy found an indolent cancer. When a biopsy finds indolent cancer, either you have only indolent cancer or it just didn't find the aggressive cancer because it's a biopsy. So when we're coming up with a test, we took our volatile compounds that we found by GC mass spec, and we decided to train using the cancer-free samples and the 7+, the definitely had cancer samples. And when we put them together, we had pretty remarkable results. For training, 29 out of 33 of the cancer samples were found to be on the cancer side, and 35 out of 38 on the no cancer side. Then this, however, needs to be cross-validated. So we did this using leave one out cross-validation, which is a very common methodology used. And our accuracy went down slightly. For leave one out cross-validation, you take out a sample, you train with the other samples, and you test. And then we still had 89% accuracy for cancer and 92% accuracy for no cancer. The second thing we did to test our system was we took our Gleason 6 samples, which we thought are probably indolent and shouldn't require further activity, and 10 out of the 14 of those came back as no cancer found, and 4 out of the 14 said, we think that there could be aggressive cancer. So if you'd use these on, it could have saved, well over half of the biopsies from having occurred if this were a test today. Now, it's not a test yet. This is just the beginning of creating a test. So that's like a high-level overview of the results.
And the method that we are using can also can distinguish between indolent and aggressive prostate cancer, which is also a very important problem, because men who are diagnosed with aggressive prostate cancer, especially at their metastatic situation, only 28% survival rate is noted. So
for 5 years.
For 5 years survival rate. So I think the methods that we are proposed and are working on could lead to a revolutionized way of looking at prostate cancer and diagnosis especially.
All right, thank you. Are there any questions? And if so, please wait for the microphone, state your name and affiliation before you ask your question.
So it's Kath O'Driscoll from Chemistry and Industry magazine. I may have misunderstood slightly. There's something in the press release, and it talks about, you mentioned the 89% figure for the detection. But it says here that 10%, so 10% presumably who do have cancer didn't have those chemicals.
So we didn't find the chemicals in 10%. Yeah. Okay,
Right.
so
But then they wouldn't go on to have biopsy, I guess. I'm thinking this would be a replacement for...
this would be a replacement for
the
a PSA test. So
Yeah.
those 10% may not go on to get biopsies. Right. So we're hoping to refine the test and perhaps get a better, when we do wider screening, to get better results than that. But you have to remember that the PSA test itself is only about 70% accurate, so it misses a lot of cancers itself. So, we're not replacing something which has 100% accuracy with something with 90% accuracy. We're replacing something with 70% accuracy with something
90%.
with 90% accuracy. So, although it's very hard for people to say, but if it's very hard on the people who find out later that, And another thing
What
is...
level of accuracy would you need to get up to with this test in order for people to accept it as a replacement for PSA?
So for that, as I mentioned, the recent studies using dogs, they were able to get 98% selectivity and specificity. So we are targeting to that range, especially once we identify these molecules. We want to validate that with using trained canines that can sniff prostate cancer. So once the trained canine can say that these are the molecules that they are sniffing, then that would be a really breakthrough, and we can say that this can be done with a high selectivity and specificity.
Thank you.
Ben Valsler, Chemistry World. I'm just wondering what the sorts of compounds are that you're finding in the positive samples, and what the mix is like.
Okay, so we're not comfortable with releasing the exact chemicals. They're all of the right size for endogenous metabolites. So it's not like we're seeing something that isn't endogenous metabolite, but the exact molecular identification, we're waiting until we can validate it by buying them and running them and making sure we get the right retention time. We will say some of them are increased, 4 of them are increased in the cancer, and 3 of them are decreased.
And in terms of, clearly in terms of convenience, there's a benefit. In terms of the resources required and the effort it takes, how is this likely to compare to a PSA test?
Efforts, basically at the end we would like to see, there was this, like a litmus paper, just expose it to the urine headspace and you see a change, and that change will tell whether you have a prostate cancer or not, and how aggressive or indolent that cancer is.
So
So as simple as that.
we hope to get as simple as a PSA test, which, basically seems to happen. Even better would be same-day results that you could discuss with your doctor. PSA test is practically the same day. Another way this could be useful is it could supplement a PSA test for the 30% that aren't found by the PSA test. If this could find more cancers, then this could benefit people.
Doug Dollimore, American Chemical Society. Doctors, could this test potentially be adapted to detect other types of cancer?
Yes, there are. So basically, this study also started with not only cancer, but other kind of disease conditions, especially like, you have seen diabetes alert dogs that can alert patients of their diabetic condition, especially hypoglycemia. So we started a project that can identify what those molecules are that dogs are sniffing to alert their patient of their hypoglycemic condition. So this was a kind of of that project. But there is breast cancer or even bladder cancer that can be detected in the same way.
So adding on to that, I think that the canines can sniff in the urine all kinds of cancer.
Yeah.
But because the urine runs through the prostate on its way out, the prostate cancer signal will be larger, as will the bladder cancer signal, and we're hoping in the future to differentiate between bladder cancer and prostate cancer signals. So we're trying to go for an easy target first. But yes, one day it's possible that we will be using volatiles to detect all kinds of cancer and other diseases. And it's like you see in the visible light range, but when we figured out that there's UV and X-ray, all of a sudden we could see a lot more. Yeah. And so chemists are used to looking for molecules a certain way in liquids, but when you open it up to looking for volatiles and using a different ionization methodology, then we're hoping to see more and to use it to improve human health.
And engineers, if they know what molecules they are, they can build better sensors.
Hi, so it's Kath O'Driscoll from Chemistry and Industry again. What quantities of these chemicals are you detecting in the headspace? What sort of?
It's better than parts per million. Okay. Yeah.
Following up from that as well, do you think there's any sort of concentration effect? So is it just a binary, we've seen this, therefore you should investigate further? Or are you saying there's a lot of this around, therefore we suspect you have very aggressive cancer?
We're seeing difference. This is metabolites, which means that they're things your body produces, and they'll produce more of it or less of it, depending on what your body needs and whatever the cells are pulling from it. So we think it's a more and a less situation, not an on-off.
So you could prioritize people for these top third, most urgently need further tests?
Yes. So based on the concentration.
Well, the idea is to cut down on overall number of biopsies without reducing the level of care and continue to find as many people with prostate cancer who do need treatment.
Bela Puslik, American Chemical Society. These compounds, I presume there are more than one. And is there some pattern recognition that might be useful here to distinguish the types of cancers, or whatever we're looking at, even at parts per million or parts per billions?
Again, very good question. So basically what we are trying to find is the fingerprint of this signature that can specifically is specific to one type of cancer. And hopefully if we extend our studies to other type of cancer like bladder cancer, then we can show, we hope to see that these fingerprints are different for different types of cancer. So yes, it's a signature of more than one molecule. It's as our study shows that it's about 6 to 7 molecules that combined shows that there is a signature of prostate cancer.
Thank you.
Katie Cottingham, American Chemical Society. I was just wondering what's next for your group. What's your next step?
So next step is the 2 dogs that are trained for detecting prostate cancer are in Italy. So we need to train. So we have a collaborator who is a dog trainer. So we are hoping to start that work as soon as possible to train and then validate the molecules that we have identified analytically using those trained dogs. And then once we validate, we want to go for that strip sensor that can be, that can recognize those molecules and give a signature of prostate cancer. So about, you can say, in a year or so, we'll be able to show that we are at a stage that we can develop those sensors.
Any further questions? All right, thank you. The archived version of this session will soon be posted at bit.ly/ACSlive_San Francisco. Please join us for our next press conference today at 1:30 p.m. Pacific Time on ridding the ocean of plastics by turning the waste into valuable fuel. Thank you very much.